Bismillah ar-Rahman ar-Rahim. I'm Ethan Nabil Khalid, final year medical student from Baghdad University College of Medicine. In this lecture, we are going to talk about mechanism of action of different antibiotics. Objectives is to know the mechanism of action of different antibiotics, and number two is to understand the clinical difference between bactericidal and bacteriostatic antibiotics. قبل ما نبلش احنا بهذا الفيديو ما راح نحكي عن تفاصيل الميكانيزم اوف اكشن، ما راح ندخل deep within the pharmacology of الميكانيزم مال اكشن مال different drugs، بس راح نحكي الاشياء اللي to consider in daily clinical practice when dealing with antibiotics. Antibiotics can be categorized by their mechanism of action into three groups. Number one are those that inhibit cell wall synthesis or function. Number two are those that inhibit nucleic acid synthesis or function. And three, those that inhibit protein synthesis. Number one, antibiotics that inhibit cell wall synthesis or function are, first of all, is the beta-lactam antibiotics. Here, most commonly used antibiotics in a clinical practice include the penicillin, the cephalosporins, carbapenems, and monobactams, vancomycin, daptomycin, and polypeptides. Antibiotics that inhibit nucleic acid synthesis or function are three groups also. Those that inhibit the DNA gyrase are the quinolones. Number two are those that inhibit the folate synthesis like trimethoprim sulfamethoxazole. And three, those that create free radicals like metronidazole and nitrocuritoin. Antibiotics that inhibit protein synthesis, these are the last group. Number one, those that inhibit the 50S ribosomal subunit are the macrolides, the clindamycin, lansoprazole, streptogramins, and the chloramphenicol. طبعا most important يعني macrolides. Number two, those that inhibit 30S ribosomal subunit are the aminoglycosides, tetracycline, and tigecycline. ممكن انه يعني ال difference between انه منو دول اللي تنهبت 50S and inhibit 30S ribosomal subunit، يعني هذا الشيء مهم clinically. الحقيقة no, it is not important clinically، بس احنا ذاكرين هنا مجرد حتى for easier classification. Bacteriostatic versus bactericidal antibiotics. For those who are not familiar with these terms, bactericidal antibiotics are those antibiotics that kill the bacteria, and bacteriostatic antibiotics are those antibiotics that stop the growth of the bacteria but they do not kill them. السؤال، هل من المهم انه اعرف اني كل antibiotic هو bacteriostatic or bactericidal، وهل من المهم انه افرق منه هذا ومنه هذا ومن اوصف antibiotic لبيشنت؟ الحقيقة تقول بأنه there is no evidence that bactericidal antibiotics are better than bacteriostatic ones in most clinical situations. Situations in which bactericidal agents are traditionally preferred over bacteriostatic are endocarditis, meningitis, osteomyelitis, adeneutropenia. So, unless you are dealing with one of these conditions, سواء أنت suspect you are dealing or proven you are dealing with one of these conditions، ما يحتاج you put much of a thought إنه هذا الانتيبيوتيك هو bacteriostatic or bactericidal. اكو فاكت لوخ تقول بأنه some of the antibiotics هي bacteriostatic at one dose and bactericidal at another dose, and some of the antibiotics are bacteriostatic against one bacterial species and bactericidal into other bacteria species. So, unless you are dealing with one of these conditions, there is no much benefit from knowing that this antibiotic is bacteriostatic or bactericidal. These are the references for this lecture, and thank you for watching.